I tested positive when I was still in Zimbabwe, and that was about 32 years ago. I was very young, I think I was 19 at the time. And this is in 1994, I think, yeah, 1994. And no one was talking about living beyond 6 months at the time. And I made a commitment to myself that I was going to live a very long, normal life, even though treatment was not an issue, it was something that we had even thought about at the time.
Like I went into the forefront to fight HIV, to say, okay, I just got tested of HIV and I'm a youth. How can I help other young people? Like from the fear that I had to say, I'm HIV positive. Should I continue with school? I just finished high school. Should I go on into university because I'm gonna die soon? So after getting that confidence of saying I'm not gonna die anytime, I started pushing for spreading hope and knowledge and information to others. So then there are so many people, some of them don't know, and they start stigmatizing you in shelter. Oh, so I want to go, when you go to your medicals, things will change. You won't get your work permit. I was so discouraged. And I stayed in shelter, I had my meds for 3 months. Then when I went for my medicals, I got tested, everything. I already know that I'm HIV positive. So I told the people that were testing that I'm already on meds. After I got tested, then when you are HIV positive, there are so many other conditions on you that can come out different from someone who is just tested and is positive. So they suspected I had TB. And normally after the medicals, your work permit comes after 3 months. For me, I had to wait for 7 months. And I'm stuck in shelter, I'm depressed, I miss my work back home. People are telling me, anything you do here, they're gonna arrest you. Because here in Canada, there's HIV criminalization. We don't know about it back home. We don't know about it.
Today is me, tomorrow someone else. It's me and you, we've gotta stand up and fight. We'll shed a light in the fight against AIDS. Let's come on now, let's stand together and fight AIDS. In times of joy, times of sorrow, let's take a stand and fight unto the end with open hearts.
Hi, Ricky Henry Live.
Ricky Henry Live. Woohoo! Shout out to Ricky Henry Live.
And now, ladies and gentlemen, we'll have Richard, who is going to give us a presentation from he's going to give us a presentation while we wait for somebody else, and then we'll go into the panel discussion. Ladies and gentlemen, Richard, please, an applause for him. He'll tell you his second name because I did not want to mess it up. Richard, my name is Juliet Sesam. So you see how complicated this the other name is, huh?
If we are Africans, the names should not be complicated at all. My name is Richard Butoti. I'm going to be saying a few words about PWA. So PWA stands for the Toronto People with AIDS Foundation. And here's the other gentleman walking now. So we're going to have, what we've done is we've prepared some questions that we thought would be pertinent and that people might want to know about. So once Damien gets in, we're going to sit down and then we'll go through individual stories about how we came to Canada and some of the challenges or issues we faced as people living with AIDS, moving to Canada, here in Toronto, and how organizations like the PWA have been able to support people living with HIV and AIDS, access services, access treatment, access housing, access other social services that are available in Toronto. So maybe I'll start with myself. I tested positive when I was still in Zimbabwe, and that was about 32 years ago. And the reason I was getting my test was so that I wanted to get an insurance policy. And part of the insurance meant that you had to get a test. So rather than get I was very young, I think I was 19 at the time. My employer suggested that I go to my own personal doctor before I go to I used to work for a commercial bank. And so I went to my private doctor, and at that time, my doctor actually laughed and thought, there's no way that you need to get tested. What we should actually do first is do what was called then, I think it's still there, an FBC, a full blood count. And so I got that test done, and the results came back, and then there was an indicator that I should get a proper HIV test done, and that's what I did. And so immediately I thought to myself, I'm not sticking around in Zimbabwe, because at the time, and this is in 1994, I think, yeah, 1994, and no one was talking about living beyond 6 months at the time, and I made a commitment to myself that I was going to live a very long, normal life, even though treatment was not an issue or something that we had even thought about at the time. So soon after that, I decided to leave and come to Canada. And when I got here, I think it was in 1995, June, actually, around this time of the year. So this last week, I think, was 30 years that I lived in this country. And I moved into a neighborhood not too far from here. And at the time, which is still the same, if you didn't have legal status, you couldn't access healthcare treatment. But there was a community health center here in Regent Park. There used to be somewhere down the street, Regent Park Community Health Services. They've moved now to a bit further on Dundas, but at the time they used to occupy a little room in an apartment building. And so they were seeing people that didn't have status in Canada, providing medication for those that chose to get medication. And personally, I wasn't interested at the time in taking any medication. And fortunately, I connected with a doctor who was open-minded. I still have the same doctor today, even though he's left now Regent Park, but I followed him to his practice. And I was able to access treatment, not necessarily medication, but having access to a doctor, having access to any other healthcare needs that I had at the time. And I think what that taught me as someone who just came to this country is something important about healthcare in Canada, or healthcare in general. You are the best advocate for yourself. We have wonderful doctors, but they don't know your body the way that you do. And it is incumbent upon the patient, and I think this country is a patient bill of rights, if I'm not mistaken, right? Which is very important for people to know and to understand, because we're coming from an environment where when you go to the doctor, whether it's the medical doctor or the traditional healer, you don't really have much to say other than being told this is what's wrong with you and this is what you need to take. But a huge part of medicine is the preventative aspect, is being able to know what got you to a point, to how you're feeling, and sometimes it is not an event, but a process. So you need to know, I usually keep this type of pads, right? So if I get a headache or if I have an upset stomach, I write it down, and I write down if I've eaten something or if something might have happened to me, so that when I do go to my doctors, which can be once a month, I have something that I have on me that I can tell him, this is how I was feeling over the past month. And sometimes some of the things that we deal with are a cumulative effect of various things. So So that was something when I came to Canada that was quite helpful in my own story in terms of being able to have a doctor who was informative in terms of telling me, you know, this is your journey. I am here to offer you support. And because one of the first things I told him is I wasn't interested in medications, because at the time, you know, medications, people were taking like 60 pills a day, right? And I am not there running around with 60 pills in my pocket. And at the time, I was a young professional, just getting back into the profession that I was doing in Zimbabwe, which was software development in financial services. So the last thing that I needed was to have, you know, a little lunchbox that I'm running off into the washroom or whatever. And things have come a long way now, because now we have injectables, and you know, people get one injection for every 2 months or so. So things are quite different. Anyone who comes who is undocumented, who's in this country, would have a chance to access medications and treatments. There's some organizations that have always done the work, even though it wasn't in a formal capacity, but organizations like the Toronto People with AIDS Foundation had a program where they would provide individuals with medications, especially pregnant women that were coming into the country. There's also an organization that was started through Regent Park Community Health Services called the Blue Door Project, I believe. They also provide medications and access to doctors and other facilities for newcomers. So those are some of the things that were important. I heard the doctor speaking about a patient declining surgery. And one of the things that was quite significant at the time was people going on what's called a treatment holiday. So a treatment holiday is someone who would have been taking medications and they get medication fatigue. They get tired of popping pills every day. And when they get tired of popping pills every day, they decide that they can take a break. Once you decide to take a break with HIV medication, you build resistance. And once you build resistance, that could be a problem in the long run. So I think one of the key things that I learned when I came to this country is access to information. And the access to information is something that you have to advocate and do by yourself. You are not going to rely on a medical professional or on your friends or your network. You are going to do that yourself, because that is your body. And you have to understand that once you are taking certain medications, once you have that access, it is a privilege to be able to get access to those medications. It's a privilege to be able to get access to services and support, not only from the medical side, but also in our communities. I think a lot of us come from countries where there was a lot of stigma at the time around HIV/AIDS, but I do not know a single African who has not lost a family member to HIV or AIDS. So this is not something that we speak of as something in the abstract. This is something that we deal with in our communities, just as we deal with every other issue as Africans. So I think that's a huge part of the services that are provided with an organization like the Toronto People with AIDS Foundation, because another key aspect is that a lot of individuals are testing positive when they go for their medicals. So when you test positive for your medicals, as you know, those results are tabulated, and then usually you are referred to an organization like PWA, who facilitate access to programs for meds through hospitals like the St. Michael's Hospital. When I came here, I didn't have that option. So what I did again is I studied how the medicals are done. So the immigration gives you a list of doctors where you can go and get your medicals done. So I picked an old doctor in a neighborhood that I knew the last thing that he would ask me when he looks at me is if we need to do an HIV test, because at the time it wasn't mandatory. It was at the doctor's discretion whether or not he was going to do the actual test on your medical. So that was how the process was for me at the time. And living with HIV has not been an issue in terms of my life here in Canada. I have made sure that I get my medicine, and now I'm actually a parent of 4 children. The oldest is 28. Wow. So it's for me it was just an opportunity to have a normal life, and the normal drama that comes with getting married and getting divorced and all of that. So I could not have done it without the support of the organizations that exist. And that is one thing that I will always recommend to anyone, regardless of whatever situation that you're in. But as a new immigrant in this country, you have to remember that you are coming into an environment that is not going to look at you in terms of your performance and say, well, we can give him a break because this person is an immigrant. So all the other social issues that you're dealing with, the cold winters, the hot summers, no one is going to excuse you for any of those things, but you need to be able to access social services and support services that will give you the help that you need in order for you to acclimatize. So acclimatizing just isn't the physical environment, but it is also your mental health and your social life. Those are still things that you have to come to terms with when you move here. So I am going to have Susan and Damien come and share a little bit about.
It's very important to me, but also I just feel like before we hear from them, can we all stand up? And those who are from my country, I come from Uganda. And as you said, I think there's a time like Uganda, every time a household was losing someone, until there was a lot that our president did. Then later the statistics went down, and later it escalated higher. And UNAIDS was asking the questions of why is it that Uganda at a certain point it went down and later it raised up? It's just because the community became irresponsible, but right now people are very responsive. So I can request that before we listen from them, let's have our lovely song. I don't know where you come, I know you come from Zimbabwe, but there is someone who became a hero in our country, and he sang this song and it became a global icon. And it builds hope for us. So DJ, today it's me. Can we all stand up? I feel like when I speak, no one will listen to me, or how will they take me for? How will I be taken in the community? You are not sure whether the person you're opening to will keep it to themselves. So let's have this song and then we can listen to our other panelists. And because today we are here to learn and take action, and you never know from here.
Ugandan artist who lived in Sweden for a long time, and he was the first person to declare he was HIV positive, and in 1987. And he put up a big show called Born in Africa. He was a great guy. He has some of the songs we listen to every Christmas, and he sang a song called Alone and Frightened when he realized that his time was up, but he had to leave a statement, and he did us proud. I've been somewhere, alone and frightened, all the memories, the ways alone. Life is hurting, no more tending, no comfort, no more loving arms on around my neck. Take my hand now, I'm tired and lonely. Give me love, give me hope. Don't desert me, don't reject me. All I need is love and understanding. Then together. Today is me, tomorrow someone else. It's me and you, we've gotta stand up and fight. We'll shed a light in the fight against AIDS. Let's come on now, let's stand together and fight AIDS. In times of joy, times of sorrow, let's take a stand and fight unto the end. With open hearts, let's start out the speaker to the world. We'll save some lives, save the children of the world. It's called Alone and Frightened. You can Google it. Sung by Philip Bongolelutai. It's a beautiful song.
Thank you very much. That's the reason I wanted her to come, because she's a musician. For your own information, she brings the voices next to the people.
Lovely.
Because people have already heard from Richard. Briefly, could you tell us about your history, like in 2 minutes each, so that we give a background on how people are going to respond, because we are here to learn, we are here to call for action, so it will help us to give the audience on how to respond and how also to create solutions together. Yeah, I believe most of the people here are migrants like me, and the challenges we face are not different, it's just because of coming from different cultures. Thank you.
Okay, so we're just going to go over a few pointers, rather, to guide the discussion, and then we'll open the floor to questions. Speaking of migrants, I think there's only 1 or 2 people that were actually born in Canada in this room. And one of them doesn't speak yet in the back.
Oh my God. You're welcome, Canadian participant.
So we're just going to ask Susan and Damien if they could just tell us what prompted them to go and get the HIV test done.
Okay, thank you so much. The first question was to talk about my history. Then another question was what prompted me to get tested. So, okay, I'm sorry guys. When you started singing for us, it makes me think like, it makes me to lose some confidence, because back home when we were being tested of HIV, there were support groups and people would come to sing songs of hope like, oh, HIV is not gonna kill you, or they were singing songs to remind us of how many people we lost to AIDS. But to my context now, I'm not someone that wants people to feel sorry for me. And it makes me feel so small and feel like, oh, we are going back to the battles that have been fought like for the past 10 years. When I got tested of HIV in 2013, I did not only start the journey of being treated of HIV, but I also made myself, like I went into the forefront to fight HIV, to say, okay, I just got tested of HIV and I'm a youth. How can I help other young people? Like from the fear that I had to say, I'm HIV positive. Should I continue with school? I just finished high school. Should I go on into university because I'm gonna die soon? So after getting that confidence of saying I'm not gonna die anytime, I started pushing for spreading hope and knowledge and information to others. So that's where I am right now. and I became an HIV activist. I'm not afraid of HIV because HIV is no longer something that it's no longer a disease. HIV is just a condition that's not going to kill nobody. It's no longer a cause for concern. So that's it for me. Richard also asked me what prompted me to get an HIV test. I think for me it was just after indulging in unprotected sex, I just felt unsafe and said, okay, let me go and get tested. Because that was the time in 2013 when there were so many outreaches and campaigns of people saying, okay, you should know your status, get real, you need to get tested early. The earlier you get tested, the earlier you are on treatment. That means you won't die of AIDS. So that's what prompted me to get tested. Thank you.
Thank you.
My history. I was diagnosed in around October, November, or was it? So between, I don't remember the exact date, but so between September, October 2011, shortly after my birthday in 2011. Okay, so in my background, I was tested positive in the USA. I was up in college in Jamaica, and undergrad people, the persons are given the opportunity. You have to pay, but you are given the opportunity to go to the US to work during the summer to make money to come back to pay for school fees. In 2011, this was my second time going, and this was, and if we know, 2011 was the year before the 2012 Olympic Games in London. So I went, I worked, and I wrote back to my university saying that I'm going to take a year off to try and qualify for the Olympic Games. At the time, I thought I was the next Usain Bolt.
Yeah.
But I was trying to get for the 400 meters. Usain is 100 and 200. At the time, I had that dream. And when I started training, because I was down in Jefferson City, Missouri, at the Lincoln University, there was a lot of my former batchmates from Jamaica had migrated to that university. They got scholarships, so I took a year off to say I'd train with them. And for those of us who are into any type of sports, if you've been out of training for a year, 2 years, 10 years, after 2-3 weeks of training, you should know your body should be at a certain level. I wasn't feeling anything. If anything, I was feeling worse. I was feeling lethargic. And those of us in sports know that if coach says to do 10 laps, we look to see if he's not looking, and then say we've done 6 instead of done 2. No. So I was hiding in the crowd and doing less than I should have. I was instructed to do. And at the time, I thought I was just feeling like lethargic and due to the training. At least I thought so. But then it started that I wasn't keeping anything down. If I wanted to keep anything down, I had to put a lot of salt. And I was like, salt, from what I know, using salt is not good. Using a lot is worse. So I went to the clinic on the university campus. And the doctor said it seems I was dehydrated. So I was given, what's that fluid called? I was given IV fluids. Yes. I was given some IV fluids. So like maybe 2 or 3 bags I ended up getting that evening. I went back home where I was staying. And 2 days, I took a day off, so 2 days later I was back on the track. And I was still not where I was still basically getting worse. I said, you know what? Let me go to the doctor again. When I went, they did some tests. They even did chest scans. And one of the nurses asked me if I ever had TB before. I said, no. And then she said she saw some scarring on my lungs. It was some injury that I had earlier. So it was TB. I was admitted that night, and I was in a coma in and out of a coma, basically, for 4 weeks. So between September and I think I got out of that sleepiness right around November. I'm getting ahead of the story, but right around November 15th. While in the hospital, and I heard the doctors talking because I was in and out of sleep, as I said. I heard the medical people in the room talking about whatever tests they are going to perform. And during the summer, while working, previously I had only done one HIV test, and that was to get my best friend at the time, her aunt sold life insurance. So I was working, so years before I was working, so I went to her and they gave a list of tests to do, and HIV was on it. I was negative at the time, but I did the life insurance. But this was like maybe 6-7 years later in the hospital in Missouri. And having woken up, I heard the medical people in the room talking, and I said, Doc, I've been thinking, so since we're doing all of these tests, why not add, it shouldn't cost me much more if we add the HIV on it. So it was something, just wanting a peace of mind, basically. The HIV is why I was in the hospital. I'm more like AIDS than HIV. Because I was diagnosed with meningitis, and medical people know that meningitis is a AIDS-related infection. At 27, 28, meningitis in an adult can be is a AIDS-related infection. Okay. So after that day, I don't remember nothing else after asking for the test until I woke up on the 15th of November, and I was told by my best friend's mom that I woke up, well, two best friends, they are twins. Her daughter basically threatened, living in Jamaica, threatened me and said, if I feel like I'm a bad man, I die on her birthday. Because I'm told I had gone way down, and they were basically preparing for death. Her mom said she cussed, the best friend was cussing God and said, if I think I am bad, I die on her birthday. And this people had plans to kill me again. But that's what happened, and I went through, after waking up, I sometimes not having the support system in Canada, and I've found out, I've gotten the realization that the family that I was born into, even though they are not academically educated, because most of my family have dropped out of high school, midway high school, graduated high school, not qualifying for university, so not academic. But most of them accepted two, because of this, we all know there's stigma. Nobody else knows it except my close maternal family. Well, the best friends were the ones who were contacted by the hospital in USO, and then they got in contact with my family. So this family support, it wasn't all there, but acceptance, being shunned, I didn't experience on my family, but looking back, I know I can see where I was stigmatized, shunned by medical people in Jamaica, by no face status. I guess that's about it.
Oh my God, thank you for sharing and thank you for the resilience.
Thank you, Darian. Just a couple of pieces that I heard while you were talking in terms of preparing for end of life. You know, when you were hospitalized, and that's a huge part sometimes of what people living with HIV and AIDS have to deal with, because sometimes it's the healthcare professionals, you know, the individuals that are supposed to be supporting your journey and giving you the medical advice that you need, end up making decisions as if they control your destiny and your outcome in terms of your health, which sometimes cannot be further from the truth. So on that note, I also want to ask, and maybe have the two of you speak about the services and support that you've been able to get in Toronto from organizations or friends or individuals or your healthcare provider.
Okay, thank you so much. Yeah, about the services I've been receiving and support. For me, when I got diagnosed, I was still in Africa, in Zimbabwe. After the diagnosis, I did not expect much support from the family because my family was conservative and they believed that you can't be HIV positive unless if you're a prostitute. So the fortunate fact about me is I went for testing when I was not sick. I was just like this. I just walked into a clinic, got tested. I wasn't sick. They were even asking me, why did you come for testing? I was saying, no, I just want to know my status. So before I got sick, I was on medication. That's when they were giving ARVs. So I was on ARVs before I got sick. So nobody knew what was going on with me unless I would tell the people that I'm HIV positive. But I didn't expect any support because I didn't share much with my family, knowing that my mother would kill herself because she was busy struggling to say, we have no money for you to go to university. So I would not tell her. I told my mentor, who told me to my face that you shouldn't waste money going to university, you still die after. But I finished my degree in 2016 and I'm not dead. I'm doing great. So the support that I wasn't wanting, I didn't get it. But because knowing my situation, I started working like volunteering in non-profit organizations, trying also to give people support that don't have support from the families or from the doctors. I remember I was doing a lot of advocacy, fighting nurses and doctors who were discriminating, because each time we would walk into a clinic, they'll say, okay, these are HIV positive people. Oh, prostitutes from Mashingo. Like, it was like that. And I would accept that term prostitute because I need my medication. But to some girls of my age, it was not easy for them. They would get diagnosed and they won't go to the clinic because they are afraid of all those words. And in my town, it was a small town, there was one New Start Center clinic. That in that clinic, if people see you getting into that gate, you're HIV positive. So many people did not want to go to get their medication because anybody that see you walking through that gate. So for me, as a clever young person, I started volunteering in that clinic so that every day people would see me going there. And when people see me going there, the moment I'm going to get my medication, you won't know. And the other thing is, after volunteering, I think I started to advocate to say, can we become peers, like going into the community? So for that time when we became peers, we introduced like door-to-door service to say when we have like appointments, people are due for their medication, they would move around with us as peers to our friends' places, where a particular place where we want to meet our friends to collect their meds, so that they won't literally come to the clinic. It worked for us, it worked for sex workers, and also to the gays, because in Zimbabwe, that time it was Mugabe's time, gays were not allowed, we were not even allowed to mention the name gay. So to the gays now who were HIV positive, and some of them were developing anal STIs. So it was so easy for nurses to point out you are gay and they can call you police. So it was now easy for us to know that, okay, for gay men, we can meet them and give them their meds wherever they are, not them coming to the clinic. So it became so easy. I did not get much support, but I created the support that I wanted, and people end up accepting me. Like, okay, it's Susan, we can't say no. Sometimes I would go into like, this is a conference or a meeting for organizations. I would just come in, you guys are discussing your topic, and I'll come in and say, what do you say about youth living with HIV? Then people say, oh no, we can't say that topic. And I start saying, no, we need to discuss it. Some people will chase me out of the meetings to say, okay, Liv, we're not talking about that. We are discussing important national budget. They'll say, we need a budget because we are paying tax for the AIDS levy. So it was easy for us, like, we had a strong advocacy in Zimbabwe to create our own support system, because families wouldn't know. And my mom, she didn't know. She later saw like videos, YouTube of me when I go to conferences in South Africa fighting. We are people living with HIV, we need our rights. We don't want to be criminalized. And my mom would say, why were you in the forefront? What was happening? And they say, what you see is what you see. And I outgrow myself in my age to a point that people would say, so she went to France, she's talking about HIV. So they wouldn't question much because I started taking care of myself, paying my school fees, because the confidence they had to say, we paying your fees and you're gonna die. I started paying my fees and I started taking care of them. So I actually changed the narrative to a point that suits me, which was okay. When I came to Canada now in 2022, there was an AIDS conference and I was coming to speak like this. Then I see, like, back home I was taking meds because the time I was diagnosed, everything was now okay. There was treatment. Then I came here to Canada for the AIDS conference 2022, and people were talking about, like, we're discussing about so many things. Then after the conference, I decided to stay. Say, let me go to Toronto, where there is more support for HIV. Ladies and gentlemen, sometimes when I compare the HIV's work which we have done in Africa, sometimes it might be more than what is done here in Canada, because there is more discrimination and stigma to me in Canada and in Toronto than back home. Reason being, back home I had already built my name and the people are actually accepting. When we came here, the stigma was that each time you enter into a space, there might be white people, you are afraid of racism. For you being black, and they ask you your status, just to say I'm a refugee, and then I'm HIV positive. You start stigmatizing yourself. You're afraid of that. Okay, what if I don't have status? What if they are gonna turn me back? There's a time when people say, oh, if you are HIV positive, when they do the medicals, they are turning you back. You won't get a work permit. So that's where my fear was. So the stigma was coming from meeting. I'm used to meeting Zimbabweans who know about HIV. Then there are so many people, some of them don't know, and they start stigmatizing you. In shelter, oh, so you want to go, when you go to your medicals, things will change. You won't get your work permit. I was so discouraged. And I stayed in shelter. I had my meds for 3 months. Then when I went for my medicals, I got tested everything. I already know that I'm HIV positive, so I told the people that were testing that I'm already on meds. After I got tested, then when you are HIV positive, there are so many other conditions on you that can come out different from someone who is just tested and is positive. So they suspected I had TB. And normally after the medicals, your work permit comes after 3 months. For me, I had to wait for 7 months. And I'm stuck in shelter, I'm depressed, I miss my work back home. People are telling me, anything you do here, they're gonna arrest you. Because here in Canada, there's HIV criminalization. We don't know about it back home. We don't know about it. They still criminalize. So I'm like, okay, so what am I gonna do? 7 months without a work permit. My friends already starting talking, she might be positive, she might be positive. What happened to a medicals? So that's actually discouraged me. So later I got my work permit, and of course, after my medicals, public health started calling. It's the way public health will be calling and following up on you. It's like because they know that you are HIV, and before they get you, if you don't get onto treatment, you might spread it to other people. So to them, you become an agent issue.
Very important.
Yes. So they called me and referred me. I was referred to Black Cap, I was referred to PWA. That's when I came to PWA. And it was easy to have hope because at PWA they were much talking about HIV, how they like teaching us how the situation is here, and we still get our medication. Then I was referred to, I got a family doctor. They are HIV specific family doctors. The family doctors put me on meds, which are actually better than back home, because the meds we had back home, they would give us side effects. Sometimes you develop something here, sometimes your legs are too thin. There are so many things, especially as a woman and a lady in an age that you are looking for boyfriends, and you get a medication and you are walking side. There were so many side effects back home. So it was so good that the technology here, we got good medication, and it was great. When I was on meds, I think the other challenges that I faced was appointment with family doctors. It took so long. I used to just walk in, but taking long to call the family doctor. If you miss that appointment, you might meet here 3 months down the line. But we're fortunate because when you are HIV positive, the first thing is to get a family doctor. So it was easy for me. And also, like the support that I got, I built family through community. When I went to PWA, it's a group of people living with HIV. So, like, we become a community. He's sharing stories from Jamaica, I'm sharing stories from Zimbabwe. You are gay, you are transgender, you are straight. You all have like something in common. We are fighting the same devil. So it was easy for us to get support from each other. When I ran out of meds and I did not have my appointment, I remember a friend from Uganda brought 7 pills for me and said, okay, you take these ones. When you get your bottle, you also give me my own. So it was easy to build that community. And we're being referred, like they can refer us to APA, to Black Cap. So there you can get different information. And there are HIV lawyers that specifically deal with people with HIV to say if your story, your immigration story is based on you being HIV positive, they support you. If perhaps, since Canada is still criminalized, if perhaps your partner is abusing you, because back there in the streets, our partners will definitely abuse us. Like your partner can actually borrow you money and not give you back. If you start fighting, you say, oh, remember HIV positive, I'll tell them you didn't tell me. Because if I have a partner and I don't tell them I'm HIV positive, someone can sue you and say, okay, you wanted to kill me, you wanted to give me HIV, it's attempted murder. People can say a whole lot of things. So all those abuses, if we have HALCO, which deals with HIV, like HIV law, which can teach us our responsibilities to say, okay, if you are not taking your meds, if you are not, your HIV status is not suppressed, if you don't know, if your HIV is not suppressed, if you are not taking your meds well, you should always use protection. Unless, if you know that your viral load is suppressed, you can do it without protection, without passing it on to somebody. But if I'm doing something that I'm risking another person's life, because believe me guys, it's only you feeling sorry for us. Out there, people without HIV, they love us, they like us, they want to sleep with us. So we need to have that responsibility to say, okay, babe, we need to protect. Okay, my viral load is suppressed, we can do it raw. But all those things comes like they have a bearing on us. Normally, if that thing is being discussed, the one who is positive and he knows is the one who is guilty, because you know and you want to put other people at risk. So those are some of the challenges we're facing, but all the same, it's great because we have these platforms to share our stories and also get knowledge, more information and hope. Thank you.
Oh, thank you. I think that's very powerful. And hopefully you continue the advocacy for us in Canada, in the budget allocations anyway.
I have a question.
I have, and then I've been doing the blood work maybe 2 months, month and a half before my appointment to see the doctor. And my prescription that I was getting was for like 12, 13 months. So the pharmacy was giving like 3 bottles each time. So when I came to Canada, I had I had 3.5 bottles, because I usually, having started the last bottle, that's when I do a refill. I try to always have at least 1 bottle, other than the one I'm using.
Yes, actually, I think it's recommendable, because you never know what will happen in the process of getting the refill. Usually, it's recommendable that you need to have 1 bottle before you get refilled. Yeah.
Okay, so my 1 bottle would be unopened plus the one I'm using. So when I came to Canada in November, I had just done a refill, plus I had one that I was using, so it's like 3.5. And that was enough to take me until I was able to get on the Victory. Like the one that was back in Jamaica, I was taking a combination of 2 pills. I don't remember the names right now, but I was taking a combination of 2 once per day. Here in Canada, everybody, when I walk into the clinic, because I haven't seen a family doctor yet. I'm still yet to see a family doctor, but then the clinic that I've been going to, I walk in, I cannot tell if I'm sitting beside a gay man, unless the female looks butch and stud, that I can assume she's gay. I'm sitting there waiting, I'm not able to look at you and say, is she HIV positive like me? Or is she gay? I'm not here or in the same waiting area.
Yeah, it's a diverse serving community.
Yes. Back in Jamaica, STI, all those being treated for STIs are to be nice. We were put in our own section, and that's putting it nicely. We all using the same clinic building, but HIV and STIs are put away from each other, with other people. So, like she said, who said it? I think she said it, going through the gate, you was one saying that going through, if I see you going to section 1, to say it in Jamaican, how is she that? Meaning, which one is he or she have been infected with? And And with me back in Jamaica, I could not go to a clinic close to where I live, because even though my family, in the back of their minds, know and kept it to themselves, there was stigma on the streets. So I had to take, for my peace of mind, I took like 3 or 4 buses. I went 2 hours away from where I live, and that's taking the bus. If I were to walk, it would probably take me longer. But I went 2 hours away from where I was living to access medication and treatment. Here in Canada, I haven't met that yet.
Yeah, it's because the community is very diverse and inclusive, and when you go to access healthcare service, they do not discriminate. They don't know what has brought you. So it's between you and your doctor, the one you're talking to, and that's what makes us different. But also, it's an advocacy issue for us who are in this room and other sisters and brothers who are not here, that we can advocate to help and reduce on stigma, where we come from, the way, the approaches they use. The fact that you have to go in the queue, people will automatically know, oh, you mean she's also in that category? And it's like they are doing it to tell the people that actually I'm here, I'm HIV positive, which is a very bad practice. Back to you, Richard.
Thank you. Just a couple of pieces that came out when I was listening to both Susan and Damien, and something that you alluded to earlier in terms of HIV prevalence or infection rates back home in Africa. What you come to notice is that our behaviors, more than anything else, are what affects our health in terms of HIV infection rates. So the behaviors that we engage in when we're back home and we move to Canada usually remain the same. That's why you see HIV prevalence in our communities will mirror how it is back home. One of the things that has happened with HIV treatment is that people have become complacent in their use of condoms and protective barriers when engaging in sex. Because they think, if I test positive, there's access to medication, there's access to treatment. That has led to younger people now being the highest who are getting infected. So the ages of 15 to 24, I believe, in most African countries have the highest infection rates. I was in South Africa for a time, from 2008, I returned back home. I wanted to live in Africa permanently, but things changed and I came back. But when I was in South Africa, there's a lot of complacency that I noticed in terms of people when they have access to medication, access to treatment. And South Africa is one of those countries that has a very advanced or developed surveillance, monitoring, and evaluation, and they put together statistics. Part of the problem that they're having now is that high school kids and this, what is it called in Africa, the side chick culture, and all the things that are being normalized are leading to high infection rates. Another thing that has come up when I was listening to the other speakers is the stigma from medical professionals. And that's the part that I alluded to earlier on in terms of when you're here in Canada and you're accessing services, and it doesn't matter if it's healthcare, it's school, it's where you rent, where you live, anything. One thing I've noticed as an African is that we are always looked down upon. People think that all of us come from the village and we didn't get an education. And when you walk into certain spaces, that's exactly how you're treated. Sometimes even when you open your mouth and you speak better English than them, they're surprised and they'll even ask you where you learned English. You know? So there are a lot of things that already are working against you just from looking at your name before you walk into a space. They look at your name, they see an African name, and already they've put you in a specific category in terms of your level of intellect and how you understand basic things in life. And I think that is something that we always have to be cognizant of as Africans, wherever we go, that we're always going to be looked upon in a set, and that's not just from white people, that's from Indians, that's from other black people, that's from any other community. Always looks at us as if we're at the bottom of the social totem pole, if you will. So that's another thing to be aware of when you're accessing services, is that professionals, and that's not exclusive to healthcare, professionals in general will always have a way that they look at Africans, so for us to be aware of that when we're going to the spaces. And lastly, on my questions, the one thing I would like the panelists to share is what advice you would have for someone who is coming from Africa who is already HIV positive, or someone who comes to Canada and gets tested for the immigration or whatever process that they're going to, and they find out that they're HIV positive. What advice would you have for those individuals?
Alright, question. Like when someone is just coming in and you're tested positive, or I meet a lot of friends that get tested positive when they're doing the medicals, and it's so hard for them to accept because they're just coming to Canada and they think everything is okay, but they've been positive for a while. So my advice is that we are in 2025. HIV is no longer a problem. HIV is not AIDS. AIDS was a disease which was killing people from 2004 backwards, when we did not have the medication and the right technology. But I think if you're coming and you're getting tested right now, you are actually privileged because the community knows. People are getting more awareness about living and socializing with people living with HIV. And in Canada, no one is going to stigmatize you. It's so different from back home because people living with HIV have got rights. Right now, as I'm speaking, even if we meet at Dundas Square and I'm doing whatever I'm doing, you can't even point out at me and say, oh, she's HIV positive. It's my privacy, and I have that right, and you can be arrested for that. So I think if you are tested and you are a newly HIV diagnosed person, I think in Canada you are in safe hands. The other advice I want to give is that continue practicing safer sex. It's so hard. People don't want to talk about sex, but they want to talk about HIV, which is a consequence of sex. For me, I feel like we're sabotaging people that have not been tested. We that are living with HIV, because we're not telling the negatives, the truth. If I may ask people that think they are negative here, do you have condoms in your houses? No. If I ask single ladies, who are actively, sexually active, do you keep condoms in your house? No. But the other question is, do you know that the person who is sleeping with you might also be sleeping with me? So if you have never seen like one-on-one a person who's saying, I have HIV, you might think it doesn't exist. That's one thing. So we need always to be safe. And no one should determine your safety. You don't need your boyfriend to decide whether you are safe or not, to say, oh, he didn't wear a condom, so I won't wear. There are a lot of, what do they call them? The plan B. But that protects you from pregnancy. Pregnancy is not a disease, it's not a health condition. But before you take plan B, think of HIV. Apart from HIV, there are a lot of STIs. And just bear in mind that if you married, I might be your husband's side chick. If you're not married, these boys are not faithful. We might be dating the same boy. So why are you not wearing a condom? Honestly, why are you guys not protecting? And this is so common in Canada, like people are not protecting. They think, okay, in Canada there's no HIV. There's a guy I was talking to. He was saying, I like you. They said, yes, but I'm HIV positive. See, he literally said, no, there are no HIV positive people in Canada. Once they get tested, they are sent back home. That's what he thinks. He thinks we are sent back home and they are only the
That's
negative.
a myth that we need to challenge, you know?
We need to raise awareness. People don't know. We need people to know that HIV is real and it's there. At least if they see me, they might see what we can say, the face case of HIV, to say, okay, HIV is there. Okay, oh, it's there among the people that you're dating, the people that say, this is my dream girlfriend, they are HIV positive. So you need to practice it. So I think that's the advice that I can say to newcomers. And also, once you come, if you are positive, it might be hard. In Africa, we go straight to the clinics and hospitals. But here, it's so difficult for the clinic to know you without being referred. So I think you should look for agencies, like organizations that are helping, like PWA, Black Cap, there's APA, there's organizations like Teresa Group. All these, they help people that are living with HIV, and it's easy for them to refer you to say, go to this hospital, go to Women's Health. So if you connect to organizations, whatever you're going through, be it HIV or any other problem, it's easier for you to be saved better than to walk in straight to the clinic and say, hey, I'm HIV positive. Remember, the doctor went to school for HIV, but the receptionist might not know. There are so many receptionists who are going to frown at you. They're going to say, oh, I was diagnosed with HIV, so I was referred to this clinic. The receptionist will be like, how's your name? Like for you, it's a turn off. Sometimes you might go back. And also the second thing is you can even go to dental clinic. They ask you, do you have any other conditions? The moment you say HIV, she'll run to wear gloves. But is she not supposed to? If she wants to wear gloves, let her wear. I want to tell you that you need to be accept anything. You know that human beings are human beings. Some people don't know. You need to be ready to face stigma, to be discriminated. You need to ready to lose friends and some family members. Because the moment you test HIV, you're going to look for me. I want to be Susan's friends. I have my HIV friends that are only friends because they can't be friends if people are negative. They can't have anything to talk with them. And I'm going to give them tips. Okay, if you're HIV, no, you need to eat this. Let's stay away from this and this and this. Let's drink like 2 glasses only. So that's it. That's my advice.
Oh my God, I like it. Let's drink like orange glasses. I guess that's a good idea.
If we drank your so-called husbands would drink us, let's carry you home with their cars and we don't know what's going on. They collect the HIV, come give. So we need to be responsible. 2 glasses a night, we go home.
Yeah, as Damian comes in, I also wanted to clarify, we are sorry, you know the issues of culture we talked about. When we started and sang that song, we didn't know how you would feel about it, because the Ugandan version is that song was to give hope, also to call them community, that it's okay, we can always build on the people who have it, but also protect the ones that are not yet gotten it. But now you see how the culture, and it's the same thing that we face in the community, how you feel about something, someone else feels it differently, and we are sorry on behalf of everyone. And going forward, it's about what people feel that we should think about. Yeah, thank you very much.
So, advice for newly diagnosed HIV persons. As a general life rule, I try to have my own support system. So I am at home and feeling down. I can call my friends. My friends, I actually have a relationship with their parents. If we're friends, I generally say if we're friends, your parents are our parents. That's what I say to my friends. So, and I say that to the child, and I say to the mommy and daddy, you got no choice in this. You got no choice. Me and your child are friends. You are our parents, not parents are these. Both of us. And I have had that relationship that even now, while in Canada, I'm able to cook. My best friends, twin, one is a nurse in the US and one works in some other Caribbean island. And even now, I can pick up my phone and call their parents.
silence. It's good.
Even now, me and my friends were not together in the same place, but I'm still able to pick my phone and call their dad or their mom. I usually call the mom and we fight for a little bit and then we say I love you and all. But just for my own mental well-being, I'm able to call upon her, and she is my mom. So I say that to say that we as a general life rule, we should have a support system. So if
mental health, because if you start talking to someone that you've got mental health issues, they're going to send you into a mental health institution. But your mental health is important because it determines every other aspect of your life, right? So if your mind is right, if your mindset is right, it determines everything. And one thing I realized around HIV and AIDS is that the medical professionals, the legal professionals, everybody else is always coming up with different terms, decriminalizing, this is happening and this is, it's up to you as the individual, right? And so the same applies to insurance companies. If you want to get insured, because most of us now, if we're to drop dead right here, most of us cannot be buried because we do not have a funeral cover. Right? Because when we're in Africa, who wants to start talking about funerals? You only think to yourself, well, if I'm dead, they'll figure it out. They're sending me to the village anyway. What are they going to need in the village? So this is something that if you recognize that you want to get insurance cover, then you have to take it upon yourself to look for the information. Organizations can give you direction. That's important to recognize. Organizations exist, and there are a lot of African organizations, including right now that has convened us here, that are available to give you direction in terms of services that you need in the way you can get access to information.
Thank you very much. Do you want to continue responding or we go back to our audience? Julie?
Thank you so much, our panelists. That was some great story. And we are moving over to questions, a few questions before we, we have quite a number of questions, I guess, before they give their closing remarks. Okay, Mr. Chimuka.
Yes, thank you very much. The three ladies at the front, we appreciate. And ladies and gentlemen, let's clap for the gentleman and the lady. Richard, Susan, and Damien. There are certain things that people do in life that can never be attached and valued to in monetary terms. But if someone comes out and shares something that we have been able to partake of this early afternoon, we would say that it's something that's actually commendable. Thank you very much for the work that you're doing. Thank you very much, PWA, and thank you for the organizers of this conference. Now, the issue here is, we've heard whatever you've said, but the elephant in the room still remains stigmatization. Richard, you've scratched a little bit on that, but ladies and gentlemen, stigmatization is for real. The doctor who came in before, she made mention of the fact that at their hospital, people come in and at times they don't want to put across their needs or desires because of their status. Now that is your status in Canada. legal or illegal or immigrant or name it, or refugee or whatever. But when it gets to HIV/AIDS, the word status is embossed. Where I come from, I championed the issue of, I'm one of the very few that championed the issue of HIV/AIDS. I'm a Ugandan, and I'm proudly Ugandan. But back in the day, like you've rightly mentioned, Richard, insurance couldn't touch anyone who's HIV positive. And HIV positive is a sugar-coated term now. Then it was AIDS. And it used to sound very loud, AIDS. So they couldn't touch it, so we had to sit down with the people who were concerned in the ministries and tell them, hey, this thing is here and it's here for life. So we need to have a way of looking at it. So people became insurable. If you had HIV/AIDS, they accepted. They loaded your premium because you're a definite cost, but they accepted it. But it did not erase the fact that stigma is with us, is amongst us, and painfully, this I would say without even blinking, it exists in the medical industry where we live currently. I have worked with people in shelters, and some of them have gone to facilities and they kind of shunned because they made mention of the fact that they're HIV positive. With your organization, I think it's something that we need to come to terms with and discuss and see through the several organizations that are here this afternoon and those that are out there. We can go and help these people that, you know, those silenced voices that need to be heard. We need to go to this, but not only in the shelters, there are people back there. The person is in maybe a rehabilitation home because they are doing drugs or name it, or they are recovering from drug abuse, but in the process they got HIV/AIDS. They will not come out. One, the authorities are looking for them because of their mannerisms, if you may term it that way, but they have also a problem that they're fighting. So I humbly request as I resume my seat that the organizations here, through the voices that we have heard from you and those that are out there, and the silent voices that we don't hear, we reach out and fight the issue of stigmatization. It is real and it eats us inside. And you made mention of, Richard, you talked of mental health. It is a very big issue when it gets to mental health. Mental health is something that has not been addressed, just like the boy child has not been addressed. We're talking about the girl child, but has the boy child been looked into? When our very good Suzanne was saying something, I mean, you made mention, I mean, there's also the boy child. I mean, hey, it's not only the girls that we need to look at, we also have children that are boys who are going to grow into men. And HIV/AIDS is not discriminative in that it will catch the boy and get the child. So let's address that. Thank you very much.
Thank you so much, Mr. Chibuka. I'm giving you 30 seconds or a minute to answer that because apparently Mr. Chibuka has eaten up most of the time. After the answer, we'll get 2 more questions before we move over to the next. You want to take it? Okay, once. Okay. Doctor had a question, as well as.
So thank you for this beautiful panel. My question is for the 2 who are not married, so I can't remember your name, I think it was Damian and Susan. How do you navigate relationships, knowing your HIV status? And I want to know specifically because it's been said that, you know, if it's your responsibility to disclose your status to your partner. or the person that you are talking to. And so how is that going to be confirmed that the status was disclosed? Is there like a contract that is signed? Is there a letter of acknowledgement that is signed? Because I'm thinking if the person can always come and blackmail you, then what even is the point? So that is a question that I have with another section to it. And the second question that I have is for the one who is married. How do you navigate then your marriage with your partner? How are your relations like? Do you, if you feel comfortable sharing that is, do you use protection, knowing that your viral load is controlled, or is there a constant discussion that you have with your partner, every so often? Thank you.
Okay, excuse me, can we have that mic? Because this is more.
This one is tied to me.
Very tight.
Okay, your question was how do we make sure we confirm that the status was disclosed?
Yes, and how do you navigate relationship? Like, for example, if you want to date someone, do you, on the first date, do you talk about, okay, I'm HIV positive, how do you feel about that? What does it look like in everyday life?
Okay, the thing is, when I got tested of HIV, I was a single girl. I went to be tested by myself. I was in a relationship, relationships, which I knew that if I go to a person and tell them that I'm going to get tested, they will definitely say no. Especially if you're a young girl and you're dating someone who's kind of older than you. They don't want to make that decision. They're just going to ask you, do you think I'm sick? Don't you trust me? And as a woman, yeah, men will talk about the boys, but as a woman, my advice to girls is normally you are on your own. You should take care of your health. They don't care. So the moment I got tested now, I'm on my own. And the next thing was to go and give feedback. Hey, I went to get tested and they said I'm positive. Do you know the response? I think you're seeing someone. What prompted you to get tested if you're not cheating on me? It means you are now on your own. The person is literally saying, I've been positive for years and I don't want to go and get tested, because you're saying, let's go get tested, I'm positive. And the person is saying, no, I'm not going. It's your games. You might have been playing with other boys when I wasn't around. He's just telling you that I'm not going to get tested because I already know. You understand? So it's on you. The burden is on you. So from that time, going forward, people would approach me. The person that approaches me to say, oh, when the person approaches you, they might approach you, invite you for dinner, first dinner, second dinner. You have no obligation to disclose. The next thing is, you want to keep yourself safe. You are not supposed to just say, oh, I met you, you say you like me, then I'm saying I'm HIV positive. That's not it. I have to know you. Because the moment I say I'm HIV positive and you are just asking for my number, the next thing you're gonna leave me. But after leaving me, you're going to tell the whole village, she's positive, she just told me. You have to gain the trust of the person first. The good thing is you are not exposing them. Of course, you are not just giving them sex on the first day. You just have to know them, meet twice, thrice, become at least friends with them. You might fall in love, you might say, yes, we are now dating, but no, to disclose it. Later on, when you know that you trust this person, if you don't trust the person, literally the relationship might die before you guys do anything. Then if not, you feel like, okay, it's been 3 months, we've been seeing each other, I'm trusting him. It's not only about HIV. You can start sharing your own personal life story. I'm an orphan, I grew up in the village, I don't have this and this. While you are comfortable sharing, then you can actually share your story. Sometimes you don't need to. You just have to say, okay, before we do anything, I want us to go get tested. Then they will tell you. It's so easy. It was easy for me like that. I don't know how many times I got tested. I was on meds, I know my status, but I would just say, let's go test it before we do anything. So the test will tell you. After the testing, then you say, oh, I was already on meds, but I just wanted you to know. Then you see the reaction. If the person wants to go on with you, if the person wants to leave you. But normally, if you're viewed love, some people would stay and say, okay, I continue with you. Then that's when sex will start happening. And it's not always when when you think that I tested positive and men would want protected sex, you're wrong. They will continue insisting on unprotected sex. And it's for you now to know that there's cervical cancer which is caused by HPV, and because I'm HIV positive, if I get an STI, it might be hard for me to heal, so you should protect yourself. So the marriage part, after that, because I was a girl, then when I met my partner, I think we met at a certain conference which was to do with HIV, and we started talking about it. Then he started hitting on me, and I'm telling him, no. Then when we started dating, but I was in the benches like you guys, I wasn't sharing about my story, he didn't know. But because he attended a conference like this where people were sharing about it, my mind was telling me at least he has an idea of what people living with HIV go through. So it was easy for me to say, like 3-4 months down the line, I want to tell you something. Okay, I want to tell you something. Then that's when I share with him, and he said he's negative, and we went tested, it was negative. Then we continued dating for the next 3 years. Then we got married towards COVID, that was 2020. We got our child. It's okay for us because he's positive, him. He's negative and positive. I'm the one who's married, actually. The two are single, so that's why I said he's negative and positive, and he's okay with it because he knew from the very beginning.
I am agreeing with her in that it's on me to say I am positive, but at the same time, I don't want to be telling every person I meet and go on a date with. But instead, always ensure that you are in the back of your mind, you're thinking, I need to be working. As men, back in Jamaica where it was being said, I'm not sure if it's the same thing here in Canada or in Africa, women want for sex to happen, women need an ambience and everything else. Men just want a place. I'm sorry.
Yeah, that's how we are designed. It's everywhere around the world. That's how we are designed. Yeah.
Women want to be wild and dined, basically. A man, we want a suitable place. And being HIV positive, you need to always be thinking, as a man, I am always ready to go. So, and I am not going to be telling Susan that I'm hooking up with or whomever else, everybody that I am HIV positive. So what do I do? Never walk without condoms, not walk without condoms. And yeah, there is the criminal element of me not disclosing, but is it criminal if I am protecting me and you, and at the same time I am undetectable?
Thank you very much. Just to add on that, Doctor, from the experience, I used to work with the IRV, International AIDS Vaccine Initiative. I think it's for all of us to create a safer space to open up. If you don't feel safe to open someone, please never do, because you don't know what that person may do to you. It's very important to create a safer space for yourself. They usually say your life comes first. First think about how you think about yourself, then you think about the other person. So opening up, it takes a lot because you have to build relationship with that person, build mutual trust, because with no trust then you cannot open up to someone. And in addition to that, when I worked with IAVI, I can't imagine how many couples that we had, the discordant couples, just because people built trust between each other. Most of them, like someone being positive, another one negative, and we had like the longest, biggest number of couples that were very disconnected because we were working with fish folks and also the most vulnerable communities. Yeah, thank you very much.
Okay, so I'm happily divorced, but when I was married, my ex-wife was HIV negative, so we were a serodiscordant couple. And when we got together, it was late 90s or early 2000s. So at that time, when we wanted to have children, one of the things that we were looking at, they used to have sperm washing, right? And it just so happened that around that time, medication started being more easily accessible, and I consider them. Fortunately for me, my ex-wife was in research. So she was someone who was well-read and well-informed, so we made informed choices around our health, but we always used condoms. And then when we did decide to start having children, then each and every time, that's when we did it. But again, going back to what I said earlier in terms of accessing current information and making informed choices always falls upon the individual. So you have to go out there and find the information for yourself, because I know of certain spaces, right? And this is something that is hardly ever spoken about. But I know certain spaces where there was medical sterilization of people that were HIV positive. So sometimes a woman would go for a normal procedure,
and then they would take out,
her uterus,
consent, yeah.
right? Without her consent. The same would also happen to men. Right? And this is, you would think that this was like in the 90s or the 80s. No, the last case I heard was something that happened in South Africa recently. Right? A hospital was discovered that this is what they've been doing. Any HIV positive individuals that went for treatment or had some other procedure that needed to get done, they would get them sterilized without the consent or the knowledge. So, it has happened, it is still happening, and it's quite unfortunate, but people can lead very healthy sexual lives with being serodiscordant couples, and it's not uncommon. I've had instances where I've disclosed, because for me that's just one of the things that I do up front. If I'm thinking that the relationship is going to be serious, I disclose, because I'm not very good at telling lies. And sometimes, if you don't, you have to always remember, did I tell this person? And then it becomes very technical. Anytime you engage, it's like, oh, if anything happens, or condoms break, or they come off, and then you start panicking, all kinds of things. So I've always found for myself that disclosure is way easier. And I was able to get to that space by being with organizations where disclosure was something that was being spoken about in a structured way. So it's not like you just come up and you just sit somebody down and just blurt it out, right? So you look at that aspect of disclosure. The aspect of criminalization and who and how it's decided to pursue criminal charges against someone. One, there has to be an element of malice, right? So usually when people break up and there's drama and there's all kinds of things, it's only then that someone says, because most of the times they would have known of your status, right? But it was never an issue until you had problems. And individuals who've gone through a breakup or a divorce know that the worst time you will ever experience a human being is when they're going through something like that. So that individual then goes to the police and files charges. It is also then up to the police whether or not those charges that were filed by that individual are going to be taken to the prosecutor's office, right? The Crown in this country, for example. And when those charges reach the Crown, then they decide whether or not they're going to pursue criminal charges against an individual. The individuals that you might have heard of, there were some pretty bizarre cases, right? I know one man who's, I think he's currently in jail. He infected, I think, 6 women, right? So he intentionally went out and infected people. I think there's also a woman who's also in jail for the same type of situation. And then there are other people that would have gone through a breakup, right? They've gone through a breakup and someone is ticked off, and then they say, you know what? They did this intentionally, but they would have known. So it's then now up to the prosecutors whether or not they're going to pursue charges.
So for that case of breakup, I'm just trying to think like real life scenario. Let's say, how would you then advise somebody who is diagnosed with HIV to protect themselves? Because let's face it, people are crazy. Like, people are crazy.
Everybody's crazy.
And so would you then say, because I like when we say, when you get into a relationship with somebody, just like when you want to get married to somebody, cards on the table, we have to do all tests, right? Because marriage is an alliance and everything. So similarly, when you get in a relationship with somebody, we've got to do all this, which is why I like her intervention. Like, let's see what's happening so that we know everything, right? So then, would you advise somebody to say, if you don't do tests, would you have for things to break up, but you just don't know how the crazy is gonna unveil, if things end. So how would you advise somebody to protect, or would you just say, you know what, trust in them, believe in them, and put it in the hands of the law if they decide to prosecute? Should this person ever say they didn't know my status?
No. So here are a couple of things. It's almost like you have to look at it in the same way that you look at it. And one of the ways today that people do it either by sending a text message or something, right? You send somebody a text message, the situation when we discussed my HIV status and I disclosed to you, how did that make you feel? So now you have a record of communication, right? Don't send an email, because now once you send somebody an email, they know that you're trying to, right? Another way to go about it is to go and get tested, right? So now you have a record that you and such a person went and got tested at a specific place and you got the result. So there's always like little subtle ways that you can do things. And again, it's to protect yourself from the worst case scenario. And the worst case scenario is that somebody accuses you of doing something without being informed or without you disclosing the status, which in many cases is not true. In many cases, the individuals know. That's why they even go into a place of being able to press charges, right? It's because they know of your status, and then they just think, oh, I have something on that person that I can use. That's what it is.
All right, thank you very much, Richard. Thank you, Susan, Damian, and this brings us to the close of this panel, because I think it has been the longest we've ever had, because it was very educative and it's timely for us. On that note, I would like to say thank you to Richard for bringing us your lovely people. They've been able to share their stories, and hopefully their stories will build a better journey, especially for immigrants. And as usual, if you are not in front, you usually miss on a picture. We're gonna have a group picture for our panelists. Thank you.
Thank you so much, our delegates from PWA. It's been an honor to have you with us.
Are we in the picture?
Hi, Ricky Henry Live.
Ricky Henry Live. Woohoo! Shout out to Ricky Henry Live.